I'm Nedra Knurk, and I want to welcome Dr. Ambrosio Hernandez, Mayor of the City of Pharr.
Thank you.
And welcome to our Futuro RGV discussion on how COVID-19 is affecting our Hidalgo County communities and, of course, especially the Pharr community in particular. But first, I do want to thank our sponsors who help us bring these discussions to you. And this discussion and those of the other Valley leaders will be on our Futuro RGV Facebook page, YouTube, and social media for further viewing. So Futuro RGV moderator, Davis Rankin, will discuss with Mayor Ambrosio Hernandez what we are doing right or wrong, and where do we go from here. And so now, Davis, I will turn this over to you and Mayor Hernandez to help us understand the COVID-19 challenges that we face. Davis?
Well, I was going to say we could go somewhere where they don't have coronavirus, but let me ask Mayor Hernandez, first, thank you for being here. Before you answer how Pharr has, in your view, how Pharr has weathered this, is there any place left in the world where we could go and spend a week and not have to worry about coronavirus?
I can't think of a place on earth that you cannot worry about COVID-19. I cannot.
Well, I was hoping you would say something different, but again, before we get to Pharr, has the world has seen things like this before, right? Not in your lifetime, I don't believe.
Not in my lifetime, correct.
We did have the polio epidemic, and I was just a child, and they had these massive die-offs from the bubonic plague, and then it would sweep back through again. I think parts of Europe were depopulated as a consequence, but in our lifetime, why have we not had that? You know, when you think about it.
Well, I don't know why we not had it. I mean, that's a very broad question, and also you start getting into the environment and us encroaching on environment, exposing ourselves, human beings, to other viruses or even animals or bacteria that contaminate us. So it's that's a very broad question. I don't know. I don't really know the answer to that, but I know that we're much better at tracking things.
Yeah.
We're much better at communicating. Our speed to the ability for us to communicate with each other is far better than it was in the beginning of the 19th century. And so I think it's just that we're acutely more aware of when something happens. So now we're identifying things a lot sooner and hopefully reacting in a proper way.
How do you think your town of Pharr has come through this? Is it materially different than any other town?
No, it's pretty much the same. One thing I am very, I've said it before, I'm very proud of our citizens, because when, at the beginning of March, when this was first hitting, I did come on in our public TV station. I did say, or channel that is, that we're about to enter into a pandemic that nobody, as you pointed out, has been. I haven't been on it, but we must take aggressive strides now. So we went in and passed our emergency order immediately. The citizens of Pharr, what pleases me most about them is not a single one, not an email, not a text, not a phone call, not a person visit did they ever occur after that in a negative manner. They actually have been very positive, very much a team player. They understand everybody understands their dilemma. They may not be happy with being, somebody altering your lifestyle, being bogged down. But at the end of the day, I am most proud of my citizens, the fact that they have been absolute team players, doing what's best for their fellow man, their neighbor. And so but we still have our problems, our infections and death rates like anybody else, which is unfortunate.
We have not had, and I guess Pharr too has not had what I call a belligerent non-compliance for political reasons. There's non-compliance, as I understand it, because people, this is what doctors have said, people don't think, they just don't think it's that big of a deal, or it's not as bad as people say it is. That's different than some of the political stuff you see up the state.
Correct.
What do people tell you? I'm trying to think what your specialty is. I think you put a port in my son Marshall's.
I'm a pediatric surgeon.
All right, you put a port in my son's Marshall's chest, and he was. But that's a whole nother story. So have you seen? Have you been the primary physician in some of this COVID stuff?
Oh yes, I mean, as a pediatric surgeon, I see patients that come to, our children that come to the ER, patients obviously in trauma, We do get patients referred to us from the primary care, whether it's a pediatrician, a family doctor, or a mid-level, they do refer those patients to us, and they have shown up to our clinic. At the onset, everybody was, as they still are, on edge, and most parents are and continue to be very vigilant with their children. And so they would come in, they would call a couple of times ahead of time, the same day of their appointment, to be sure we're going to be physically there. Have we taken precautions to protect their children and their loved ones? Whether there's going to be any gloves, masks, cleaning supplies, they wanted to see it. No problem. We'll be happy to show you. So
show me the Lysol.
That's right. So I'm not worried. I wasn't too worried about parents. They're very much on top of it.
Before this, doctors' clinic. Well, I was going to say doctors' clinics and cleanliness, but let's go to a broader topic. I'm making an assumption that medical science physicians, if only in their head, maybe in bigger groups, are thinking, boy, we got to do this and this and this. When we get past all this, then we got to do this, this, and this. Right. There have been predictions. This is not we have more pandemics to come for a variety of reasons.
Sure.
Stuff jumping from animals to people. What is there that discussion going on? Is this something happens in doctors' lounges? Is there in the literature? What do we need to be doing? What would you tell people if they said that, what should we be doing in terms, including spending money to do things?
Right. Well, I have full confidence in what our CDC and our federal government. Sometimes we get a little off track, and I understand politics runs the world, but at the end of the day, we should rely on science when you're dealing with science and not politics. And they've done, by and large, an extremely good job in taking care of that venue. And I think as long as our NIHs of the world, our CDCs, our FDA, everybody, and all the universities doing research are allowed to do their job and without political influence, as a society in the world, we will always benefit from it because it's always ongoing. We just never knew it was there, because why would you care that somebody's studying a bug in Iowa or somebody in UTRGV is studying the grapefruits and might affect agriculture, which might affect how you eat or might affect your bacteria. So it's always been ongoing. And we as a country have been very supportive with taxpayer money, mind you, to support all these endeavors throughout the nation and worldwide, with the World Health Organization also keeping track of diseases before they get here. So I think as long as we're continuing on that process, we're going to be okay. We're always going to be faced with a pandemic. Hopefully we'll never see one for another 1,000 years, but if it comes up, at least we have ongoing research worldwide.
What do you happen to know or have a guess as to what percentage of patients who are admitted to, let's say, what percentage of patients, whether admitted to the hospital or not, whether they die or not, have insurance of any sort, Medicare or private insurance, or don't have anything?
Right. Well, I can't speak for the nation, right? I know our community. I mean, about 40% of people are uninsured. That has not changed. I mean, it is what it is. That's
4
fine.
out of 10 might not have any insurance at all.
Right, and it is. That's fine. But at the end of the day, that's something our society needs to deal with. It's not. I'm a dependent. It's not up to the. This is our community, so either we live with it or we fix it or we don't. That's up to us. We're all taxpayers, but at the end of the day, I take care of my neighbor, or sooner or later that neighbor's going to get sick and it's going to get me sick, or somebody I know, and so forth. So at some point, I think the county as a whole, including the Rio Grande Valley, needs to decide, what do we really need to do? We already brought the medical school down. Yeah. We already brought the residents down, the medical students.
Let's put them to work. Let's put them to work, doctor.
Exactly. Let's put it to work. This was a perfect example of, we should have done this decades ago, right? We would have been so much far ahead. We would have had our labs up and running. We would have had our reagents. That was a limiting, bottleneck for all the testing, the reagents, right? But maybe UTRGV, had they been here longer, they would have had their own ability to test, right? So there's so much benefits from it. But at the end, we control our destiny. There's no question. Austin doesn't control it. We control it locally. So we need to decide what's best for us on many factors, including healthcare.
For you just joining us, we're talking with Pharr Mayor Dr. Ambrosio Hernandez. He is a pediatric surgeon, and which means he's a physician and he's elected. So he's a good one to talk to about all this. The reason I brought up the implications, someone said, when your kids go back to school, you don't know who they're going to school with. That was not a slur. That meant, I don't know if these people in my kids' third grade class, whether they've had health care or not. I mean, I don't, you know, so that would be an argument for some sort of extension.
Right. But remember, in this pandemic, up to 40% of people are asymptomatic. They're walking around, playing. And so you may be standing next to somebody who actually is a carrier, and we're all different. Genetically, we're all different. We're humans, but we're different. So I may appear to you as a 20-year-old, nice and healthy, and you have those people getting in trouble, and we don't know why. They just have some predisposition to get, even though they have no medical problems. Then you have the elderly people who, and we're very, very tight community, and we have a couple of tier levels within our family. We have grandparents living with each other, some even great grandparents. Yeah. So when you look at that universe, well, if we, for instance, our children get to go to school, which I want them to go to school. I mean, I think they need that social interaction, but it's got to be safe. If we and we're allowing the children to go out, unknowns to them, they become a carrier, unknowns to anybody, because it is not as though we have the ability to test everybody every day. We don't. They come home, they happen to infect their brothers and sisters, their parents and grandparents. Unknowns to them, they may be the ones that wiped out their family or a family member, and no fault of their own. But that's because we, as a country, right, we didn't mobilize, right, as we should have, and move resources immediately, just like when a war comes around, right? You have that power to do it. Somebody has the power to do it. Let's mobilize when it needs to be mobilized. Stop making cars if need be, make ventilators, make PPE, make lab tests, do what you got to do, because you know it's coming. It's not going to go away, and let's prepare and save 330 million people in this nation. Yes, some will die no matter what we do. Absolutely. You're absolutely right. But I rather give everybody a chance at life than to say, I'll take a 1% loss and it's okay with me.
Yeah, you don't want to say that. They may say that in war, or actually they know kind of what losses are going to be, but no, we don't want anybody to die. That affords a segue to the underlying conditions. And what do people die of, right? Do they die of COVID, or do they die? What do we do about the underlying conditions? And we can't do anything about age. Actually, age is a good thing, but not obesity, not high blood pressure, not diabetes, not.
Yes, sir. Well, remember, again, since we're all different, right?
You just deal with kids, though, so you don't have to worry about that.
No, we do. We see actually a lot of obesity in children. But let's pull back a little bit and let's look at our society. Socioeconomically, are we the same? No, we're not. Education, we're not the same. So the premise is everybody should automatically do their best to stay healthy. Well, that's not always possible. Some people have two jobs. You have parents trying to keep up. Inflation's getting under control for the last 20 years. Yeah. Salaries are not keeping up. So they're having to have two jobs, which what does that do to the family core? Well, they resort to quick meals, because not they don't love their children. No. They have to feed their children quickly because they got to go work. They got homework to do. They have to help their grandparents at a nursing home, or they live close to them. So we're very busy, but we don't all have the same resources. I don't care what people think that, well, it's your responsibility. Yes, it's my responsibility. But I can tell you, when I was growing up, I didn't have insurance, not because I didn't want it. I just couldn't afford it. But that's just the way it is. And that's okay. But if everything was equal, then I would understand when people say, well, you know, that gentleman with the high blood pressure, or the mom, or the lady with obesity, they don't take care of themselves. Well, that's it. We do have a responsibility. You're right. Nobody puts a Whataburger to my mouth. You're absolutely right. But at the same time, let's be human about it. Let's be realistic. I am, thank God, I mean, I've worked hard, but I have the ability, if I want to eat a salad every day and I want to have it delivered, I can get it done. I have the finances, and I'm not complaining. It's just, I can afford it. That's fine. But not everybody can say that. Not everybody can say that they can rush off to H-E-B, which is I love the store, but they can buy the healthiest things, because it's not as though the healthy food is inexpensive. It's actually more expensive than, right? So when you look at those things, and not everybody has the time to go do yoga, and everybody has the time to go run because they have children. So it's very complicated. And it's not I don't think it's a one way fit all. And I think we just have to realize that society is complex, but if we have the ability to take care of people and we have put the right resources, I think we can get it done as best as we can. You're always going to have those outliers, right? I don't care. They're not going to do it. They can smoke, drink, whatever they want. You can't help that.
Yeah, I know. We were trying to get my mother to quit smoking before it took her, and she was always talking about somebody who'd smoked forever and eat and just healthy. Well, that ain't us. Is there information about the different how Mexican Americans have weathered this or are weathering it versus Mexican nationals,
right?
Even here, Black people, people from China, people from Japan. Is there enough data now to know that Koreans are going to suffer worse than the Mexicans, that kind of thing?
Right. Well, remember, we're in a brand new disease. Part of the problem we're having right now, for political reasons or otherwise, is nobody seems to trust anybody else's data. And so data coming out of somewhere, well,
y'all cook that data. The doctors cook that data so they can get more money out of this. I've heard that. That's ridiculous on its face.
Yes, I know. But in country from country, even state from state. So we have a problem because it's hard to answer. On a big picture, you can clearly say, well, it appears that the minority groups are suffering the most in the United States when it comes to COVID-19's death rates. It appears that way. But it also is factual that they also have large comorbidities associated with them. But it's also true that they've not had the opportunity, that's what it is, to have preventive care like they should. So it starts getting very multifactorial. And then when you get information from Europe or we get information from China, well, nobody seems to trust the Chinese, right? And the information coming from Mexico, well, is it really clean, or are they holding back because they want to have a better representation? I don't know, but
in Mexico, yes, that's the consensus of the journalists is yes. The federal government has muddied the waters.
Yes, sir. So it's a difficult question to ask. So the best we can do, and I still feel strongly that we have the best country in the world, the best scientists, the best law enforcement. If we just let those people do their job, let them tell us what they find without any political influence. The American people are smart. They'll figure it out. They can tell themselves what's happening, but we need to afford them the ability to present that data.
We here in the Valley have limited resources. If you raise tax rates, well, what am I saying? You're the mayor of Pharr. So I suggest you suggest a 20%, 20 cent increase in your property tax. Let's see what happens. No, but the state of Texas has more money. Is there any talk about going to the legislature or the Texas Medical Association presenting the legislature a plan, or are we still too busy taking care of people to have a coherent idea about what the state can do to help us? I mean, let's talk about to help us because we don't have the resources.
Well, remember the federal government through the White House and Congress, and they funneled CARES money already. So there's some funding there. But we all know this is a long drawn out process. It's not going to go away in a month. And we don't know what the ramifications are going forward for those patients that are even recovered. When it comes to funding, nobody likes taxes. I hate taxes. Everybody hates them. But I think what people hate more than that is wasteful tax.
Yes.
When you don't define what it's going to be used for. What I discuss in Pharr all the time is if we're going to go up for a bond or a tax, whatever, let me tell you specifically what it's going to use. Not only are we going to tell you, we're going to put it in writing. Yeah. And it's not perpetual forever. It must terminate once that expense is over with, because nobody likes people abusing their money and fat cats. Nobody likes that. And so I think before we go to funding, you need to get this under control. We don't even have, to this day, right? When we started in March, we didn't have enough test kits, even though we knew it was coming. Yeah. We didn't have enough tracers, right? I call you because your mom got sick, and did you get infected? What was your exposure? How close? And then, let's mitigate. We couldn't even do that, right? Because we were too busy trying to fight. Well, do we need masks? We don't need masks. Do we stay in or we don't? So we have mixed messages confusing the population, and that's our fault as government. So before you even get to funding, let's at least agree, number one, we have a problem. Number two, how are we going to attack the problem? And let's ask our specialists. The experts, how do we attack this? Put the plan in place, then go after the funding. But we got to get there sooner rather than later.
I think we could go a lot. I mean, I could still ask more questions, but I think we don't want to exasperate the people watching. We want to leave them hoping for more. So perhaps we'll have you back again. Mayor Ambrosio Hernandez is a pediatric surgeon. He is also so he sees patients, and he's also the mayor of Pharr. So he's in a good position to give us an oversight into what we start thinking about doing when we get this thing put to bed. That this thing being coronavirus, and I think I'm right that experts have said there's another pandemic coming. We don't know when, we don't know where, but let's not relax our guard. Well, on behalf of Futuro RGV, thank you very much for being with us. We appreciate it. And stay tuned here on Facebook and YouTube for more discussion of this, what we need to be doing to prepare ourselves here in the Rio Grande Valley. I'm Davis Rankin.